when we personally do not feel well. And previous to the COVID-19 pandemic, if you had a sore throat, you probably didn't dwell exceptionally on the fact that you had a sore throat, or you had a headache, or you were sneezing, or maybe had a cough, or mild upset stomach. But now all of these symptoms, which individually might not be the indicator of anything of great consequence, is now going to be foremost on our minds. Stay tuned. Coming up in this episode, I discuss some thoughts and observations about the COVID-19 pandemic and share a list of situational awareness barriers that are causing me concern. But first, let's hear from our amazing sponsor, Midwest Fire. At Midwest Fire, they know better efficiency results in less waste, and it adds value to every truck they deliver. That's why they have worked hard to implement lean manufacturing processes throughout their factory. Lean manufacturing means a lower cost to build, with the savings passed on to you. To learn more, visit MidwestFire.com. Hello and welcome to episode 313 of the Situational Awareness Matters show. I'm your host, Rich Gassaway. The purpose of this program is to improve situational awareness and decision-making for individuals and teams who work in high-risk, high-consequence, time-compressed environments with changing conditions. The SA Matters mission is simple. We want to help you see the bad things coming in time to prevent bad outcomes. Today's feature segment is sponsored by the Situational Awareness Matters Online Academy. The Online Academy trains and certifies your members on situational awareness skills essential for improving high-risk decision-making outcomes. To learn more about this highly acclaimed program, visit the samatters.com website at the top of the homepage. Click on the training tab, and there's a drop-down menu for the Online Academy. Also, I want to make a quick mention that in response to travel restrictions and limits on social gatherings, we're offering all of our programs virtually. And I'll talk a little bit about that more in a minute. I'm in the process of setting up a website for virtual programs, but in the meantime, if you want to learn more, just visit the SA Matters website and click on the Contact Us tab at the top of the homepage. All right, today's feature segment, I'm going to discuss some of my thoughts and observations about the COVID-19 pandemic and some situational awareness barriers that are causing me some concerns. Imagine for a moment if you were on a trip to Mars and you just returned from being gone for a month. And you turned to someone and said, "So, what have I missed?" What would you begin to tell them? There's no doubt that our world has been turned upside down. And in many ways, our lives have been turned upside down. I was just a week ago in Maryland. I had done a program for the Maryland Fire Rescue Institute's National Fire Service Staff and Command on Tuesday. Then I had Wednesday and Thursday off, and Friday I was to travel to Oregon to do a program for the Eastern Oregon EMS Conference. But on those 2 days off, I had planned on just hanging around the hotel and doing some work, some content development and podcast recording and things like that. Well, on Thursday, everything got turned upside down. And starting on that Thursday through the following Tuesday, every bit of my business got postponed. 44 programs got postponed in a 5-day period. And I don't say that looking for any sympathy. Rather, I say it to put an exclamation point on how all of our worlds got turned upside down. Mine, in a 5-day period, went from having business all the way through the summer, March through the summer, to not having now anything until September. The only thing that I have are virtual training programs that I already had scheduled with departments who were going to have me do things remotely over the internet anyhow, and obviously they haven't canceled those programs. And I know that there are many out there in the same boat, and in many cases in a worse boat than I am. I don't have any children at home, so I don't have to worry about homeschooling issues. It's just my wife and myself, and I have one of my 4 children still left at home. And he is, fortunately, he was working 2 jobs and going to college. The college shut down, so he's not in school now. And one of his 2 jobs has ended. They just told the employees they don't have any work for him. And his second job, he is still, for now, working, but that is likely to come to an end because it's a retail job here in Minnesota at a hardware store. And as I've spent a lot of time this past week just checking in with firefighters that I'm connected with, there's no doubt that everything has changed and that the pandemic is creating an upheaval in the lives of first responders, and especially where maybe both wage earners in a family are employed as first responders, or one is a first responder and one is a medical provider in a hospital with kids at home. I can only imagine the stress and the challenge that this is creating for you, and for that I feel for you tremendously, and I want to help. So one of the things that I have done, I've put this out on my social media, is that I'm offering departments a 1-hour situational awareness class. Basically, situational awareness 101. What is it? Why is it important? How do you develop it? What are some of the challenges? Now, it's only 1 hour. You know, when I teach this class regularly, it's a full day, 8-hour class. And so it's just going to be like a high-level overview about what situational awareness is. But I figured, if I could just get responders to sit at a computer and give me just an hour of your time, that I might be able to help improve awareness for yourself, for your family, for your fellow responders. And I'm doing all this for free. So if your organization is interested, you can visit my website, samatters.com, click on the Contact Us tab, and fill out the form. You're not signing up for anything, and it's completely free to get this training. And just send me a message through that form that you're interested in having your organization participate in this free training event. And I hope it will help you and help your family and help your members improve your understanding of what situational awareness is. At no other time in history can I remember that I've heard so many medical professionals, elected officials, governors, even the president, speak the term situational awareness and how important it is. But the truth of the matter is, as I know, there are many responders who know that situational awareness is important, but they don't necessarily know how to develop it. And so what I'm going to do in that 1-hour presentation is I'm going to take the mystery out of it and explain thoroughly how to develop and maintain situational awareness. Now, anybody who's been in one of my programs knows that there are things that cause problems with situational awareness. I call those situational awareness barriers. Anything that blocks or prevents or impedes your ability to have situational awareness is a barrier. And when I was doing my research for my PhD, I started to amass a list of situational awareness barriers. And as it ends up, there's about 100 of them. And I have podcasted often about these barriers, especially the ones I'm most concerned about for first responders. And I call those the Dirty Dozen situational awareness barriers. In fact, those 12 are the subject of this book, this new book that I wrote called How Smart Workers Use Situational Awareness to Improve Safety. I focused on the Dirty Dozen situational awareness barriers because they are so prevalent in the environment where people make high risk, high consequence decisions. However, I went back and I looked at the Dirty Dozen list, and I looked at the full list of situational awareness barriers, and something popped to me that is a concern, and that is there are situational awareness barriers that, because of this new pandemic, I now have concerns for you that maybe were not as much concern for me before, but have elevated in my concern. And what I would like to do is to go through those barriers. And I'll ask for your patience and understanding to hang with me, because there are 25 of them. And some of them are on the Dirty Dozen list, but many of them aren't. And that's what the concern was, is maybe I haven't spent very much time with some of these barriers because they are less frequently occurring in the near miss and casualty reports that I review. So they weren't on the top of the list, so to speak. So what I'd like to do is just to go through some of these barriers and share with you how they might impact situational awareness. Now, before I do that, I just want to give you like the really high level overview about what situational awareness is. So here's the definition. Situational awareness is your ability to perceive and understand what's happening in the environment around you while being mindful about how time is passing. For as time passes, conditions change. And as conditions change, then so does awareness. And then being able to use that information to accurately predict what's going to happen in the future and to make those predictions in time to prevent a bad outcome. And as you can tell from that definition of situational awareness, there's probably been no greater time in history where the importance of this knowledge and skill set is valued, especially in the first responder world, as is today. So the three main components of situational awareness is perception, which is gathering the inputs. I often in my classes term it as gathering jigsaw puzzle pieces. The understanding part, the second component, is the assembly of the pieces, the assembly of the jigsaw puzzle piece to help you to understand the meaning of the five sensory inputs. What you see, hear, feel, taste, and smell all getting added together, the puzzle pieces all getting assembled to allow you to form an understanding. And then, based on that understanding, having the ability to mentally look into the future and to be able to use a skill set to see the bad things coming. And if you attend that 1 hour free training session, I will go into more in-depth detail on each of those component parts, but I don't want to spend a lot of time with them here because I want to focus on some of the barriers that I think are of a greater concern to me now than maybe they were previous to this pandemic. These are not in ranked order. They are basically off the master list of situational awareness barriers. So what I did is just went back to my research and said, what are the full list of the nearly 100 barriers? And as I just went down the list, I just captured the ones that were concerning to me. So there's no priority to this, although some of them maybe cause me more concern than others. So the first one I want to talk about is fear or worry or anxiety. And there's certainly plenty to be fearful of and plenty to worry about and plenty of things to be anxious about. So when we are operating in the moment, we are capturing information and processing information at the conscious level, consciously paying attention to our work environment. But if we have on our mind some fear or some worry or some anxiety, then we may not be consciously paying attention to our environment because our thoughts, our conscious awareness is on that which is causing us fear or worry or anxiety, which then can then flaw our awareness about what's happening in the moment because our mind is elsewhere. Maybe we have a family member who's not well, or maybe we're worried about our kids being at home with or without home schooling going on, or maybe we're worried about our bills and our finances, or the employment of a significant other, or our own employment if we're a volunteer firefighter and our full-time job is at risk. So we're operating in the emergency situation, high risk, high consequence, but our mind is elsewhere. The second barrier I want to talk about is illness. When we personally do not feel well, and previous to the COVID-19 pandemic, if you had a sore throat, you probably didn't dwell exceptionally on the fact that you had a sore throat, or you had a headache, or you were sneezing, or maybe had a cough, or mild upset stomach. But now all of these symptoms, which individually might not be the indicator of anything of great consequence, is now going to be foremost on our minds. I have a friend who's a firefighter who went home from work sick yesterday, and he had flu-like symptoms. Nausea, body aches, just generally not feeling well. And feeling poorly enough to report off work and go home, which was probably the right thing to do. But now he's at home and worried about, is he going to test positive for COVID-19? When should he go and get the test? How does he quarantine from his family? How can he keep small children at home from having access to him, even if he locks himself in a room? I talked to my son, who's a firefighter, and I said, what's the plan in your department? He said, well, if we get exposed or we test positive, we're to quarantine at home. And I said, well, how's that going to work? You have a 2.5-year-old and a newborn and a wife. And how does that work? And he said, I don't know. He said, my 2.5-year-old, if he knew I was in a bedroom, he would bang on that door until his knuckles bled to get me to open up and let him in. And I can't even imagine how much he'd cry and throw a tantrum until he could get a chance to access me if he knew I was on the other side of that door. He said, quarantining at home is and not having access to my family is going to be a significant challenge, if not impossible. My son has a dog. This other firefighter I was speaking to has a dog. Is it possible that if the dog was in your presence and then went into the presence of other family members, on the dog's fur, could the COVID-19 be transmitted from your pet to another loved one? These are all very significant and realistic concerns, but what it does is it raises illness, even minor illness, to a whole new level of concern, which then can impact our awareness of being conscientious of what we're doing in the moment, when in the back of our mind we have these legitimate concerns about our own health and wellness, especially if we're exhibiting any minor symptoms of not feeling well. In any given day, the symptoms of a cold would be maybe for many of us a minor inconvenience in the course of our daily life, but we would never think of quarantining ourselves as a result of just having a cold. And now we don't really know if those symptoms are the cold or if those symptoms are the early indicators of that you might test positive for COVID-19. So the level of concern over illness is much higher. Another barrier is anger and frustration. I think there are plenty of reasons to be angry. Angry at the government, angry about shutdowns, angry about the origins of the flu or of the COVID-19, frustrated about the things that you can do now, the things you can't do, government-ordered shutdowns and restricted access and social distancing, and the kind of things that were just not at all part of our world or even conceivable in our world just a few weeks ago. Yeah, I'm sure if you're paying attention to the news, you heard there was some virus identified in China, but we probably didn't give much concern as to how quickly that could affect us, and not just us, but worldwide, and how many countries around our globe are being impacted by this. It isn't just us. It truly is a worldwide pandemic, and we all have plenty of reasons to perhaps be angry or frustrated about it, but the truth of the matter is there isn't much we can do to change the current situation we're in other than to follow the guidelines that are provided to us, including social distancing and hand washing and all the precautions. You don't need for me to run you through that list again. That is adequately being communicated by public officials and medical professionals. The next barrier is denial. And I'm seeing some of this in some of the responders that I'm talking to, that out there is an element of people who think this is all being over-exaggerated, blown out of proportion. No worse than the flu, no worse than Ebola, no worse than SARS, far less deaths than the common flu. And if we are in a mindset of denial, it's very easy for us to dismiss that information which we do not wish to believe to be fact. Now, it's not for me to tell you what's fact or what's not fact, or who's being forthright with us or who's not being forthright with us, or how accurate the information is that's coming to us from different sources. But what I can say in an observation from a distance is that there is serious concern among some of the most talented and well-respected medical professionals out there, and not just in the U.S., but around the world as well. And a number of countries, not just ours, are taking some pretty drastic measures to try to, as they term it, flatten the curve on the growth of new cases, so that we don't overwhelm the healthcare system. But there are still some who are in denial, who think this is a hoax, who think this is perpetuated by the government to create martial law, to control our lives, to take away our guns. I've just heard so many different perspectives, especially on social media. And I'm not here to say who's right or who's wrong, but I think we do well for ourselves to avoid being in a denial mindset. Whether that's on an emergency scene or in this case, to heed the advice of those most knowledgeable, and to do things in the benefit of society. I looked at the news story about the college students that were enjoying their spring break, believing that it was a right. I saw some of the interviews. This is a classic example of denial. Not adhering to social distancing, saying it's just a bad cold, and I saw these interviews and I thought, oh my gosh, I hope they're right. I hope they are right. I hope that as a society we overreacted and they got to enjoy their spring break, and we were, in the end, we were the foolish ones. But I just saw now where 5 University of Tampa students have tested positive for COVID-19, coupled with, now I saw a statistic, can't validate its truth or not, that 40% of the cases are happening for people between ages 20 and 52. So that would probably put those spring break enthusiasts in that category. And if they're not personally at risk, they certainly put others in their family and others in their surroundings who are at risk and high, for medical conditions in a bad place, all because of their denial. So I don't really think this is a time to be in denial about what the professionals are telling us, but I understand that there are some people that just have this distrusting mindset that don't want to believe anything that government is telling them. And I don't know that anything that I'm going to say here is going to change that outlook. The next one that I have some significant concern with, and actually this one came to me. Well, no, it didn't come to me, but I got an email from a responder that was they're in Washington State, and I'm not going to reveal their name because I didn't have their permission to do that. But he sent me this email. It said, "Appreciate access to the proposed online training. At the risk of sounding vulnerable, I have noticed here in Washington our personnel becoming very fatigued from the constant state of what he calls, and he puts it in quotations, hypervigilance, which is a term that I use as well. Do you feel comfortable, or a colleague of yours, producing a training session for responders to let everyone know that this is hard, but there will be this whole pandemic is hard, but there will be a conclusion to it, and explain some practical ways to take time out to recharge and to stay mentally healthy." So the next 2 barriers that I want to speak to address this question of fatigue and hypervigilance. When you think of how we pay attention to our surroundings in the normal course of everyday living, you could think of that as if it was compared to walking, it would be a mild stroll. is you raise your vigilance up and become more alert and more aware of your surroundings. That equivalent of that stroll will become more of a trot. And as your vigilance gets raised to its highest level of alert, you would think of it as a full-on run. Now, the problem with this is that when we're at a casual walk, many of us can casually walk for a very long time without any fatigue. But in the course of time, we will eventually fatigue and need to rest. And the same with our day in and day out living of the normal course of vigilance. We eventually get fatigued and need to sit down and rest or sleep at night. But as our physical activity increases from walk to trot to run, we get fatigued quicker. As our vigilance rises from low-level vigilance of normal or moderate vigilance from normal day in and day out living to elevated vigilance when we perceive there to be risk and concern to significant vigilance when we're on a heightened level of alert for the dangers around us, then we can become fatigued quicker. And this fatigue that I'm speaking of, while you're running, it's physical fatigue. What I'm talking about here with vigilance is mental fatigue. And as we become mentally fatigued, we become less aware of our surroundings because our ability to uptake the inputs, eyes become fatigued, ears become fatigued. Our ability to process the meaning of those inputs becomes fatigued. Our ability to put the puzzle pieces together becomes fatigued, and it becomes harder for us to uptake, understand, comprehend, and predict future outcomes because we are fatigued from hypervigilance. The next barrier that I want to discuss is what happens when we get inaccurate information. And we are currently in an environment where there is a lot of information being passed around. Some of it from very credible sources, some of it from very sketchy sources, and absent our ability to vet what is accurate from what is not, that inaccurate information in our mind can start to be perceived as factual. And as we perceive inaccurate information as factual, it could cause us to have a flawed perception of reality because we believe something to be truthful and accurate because it came to us from a source that we didn't necessarily validate or vet, and therefore we now believe something to be truthful and accurate that is not. And I totally understand how we're getting so much information from so many sources that it is hard to vet and validate what is accurate and what is not. And some of that information, as we must acknowledge, might have a political spin to it as well. Be that from elected officials or be that from media sources. Not surprising you at all to know that there are some media sources that are friendly to one political party or another, and I have been paying attention over the last several nights, flipping between multiple stations on the television just to see the spin that is being put on the press conferences and the outcome of the press conferences, and paying attention to how stations are, some are favorable to the news reports and some are not favorable to the news reports. And they put their spin on it, but their spin can then influence us, even though that some of that information may not be accurate. And on the same vein of the volume of information being shared with us, it's easy for us to become overwhelmed and to be influenced by too much information. Our brain only has so much capacity to process information, especially in the moment, using short-term memory. So as we're watching the news, some of that information will stick with us, and some of it we will just forget because of the volume of information. It's and we're definitely in a environment right now where there is massive quantities of information flowing out of so many sources everywhere you turn. Everything in the newspaper, everything on the media, everything in the radio, everything on the internet, everything in social media has something to do with COVID-19 and sharing some information. And I know that some are intending to be helpful, but in a lot of ways it's just too much information. Stress, a barrier to awareness, and the stress is one of the 30 dozen top barriers for responders in the normal course of business as well. The higher the stress level goes, the more we have a change in our brain behavior triggered by neurotransmitters, chemical hormones that are released when we have a stressed event. And the more stressed that we get, the more likely our brain function is to change. And some of that can help us, like fight or flight, but some of it can be harmful for us because it can cause us to do things like, believe it or not, hallucinate or confabulate a reality or make up information, flawed perceptions. There's two kinds of stress. There's the acute stress of the immediate moment stress, and then there is the chronic long-term stress. And I think responders are now having to deal with a lot of acute stress, but I don't see that going away in the short term, and I see that accumulating to become more chronic stress. And for that I have a concern. Assuming multiple roles. At one time, we might have had a established set of roles or duties or responsibilities that were pretty routine and predictable, but now we may find ourselves having to do things that are outside the normal scope of what our job duties are. And first responders are like the experts at being adaptive and overcoming and assuming multiple duties and responsibilities. But the more roles we assume, the more likely we are to miss some components of our various roles because of just how many different hats we're wearing, how much multitasking we're trying to do with keeping it all together. So those multiple roles are a barrier to awareness. The complexity of our role and the complexity of information is a barrier to awareness. When we're under stress, complex and detailed information is not our friend, it's our enemy. What we need, instead of 1,000 pieces of a jigsaw puzzle when we're under stress, we need a small number of pieces, big, important pieces, but not 1,000 pieces. You think about putting together a puzzle. If I gave you a 1,000-piece puzzle and said, put it together, how long would it take you? You'd probably say, 2 hours. Reasonable. If I gave you a 5-piece puzzle, the whole puzzle, 5 pieces, and I said, put the whole puzzle together, how long would it take you? You'd probably say 10 seconds. This has to do with the complexity of information. The more data points we have, the more complex the information we're trying to process, the harder it is for us to comprehend and remember the meaning of all that information. Distraction, a barrier to awareness. Distraction are those things that unexpectedly and not on purpose draw our attention off of our task. And there's a lot of things right now happening in the world around us, clear down to you can't go to a restaurant, that are very distracting to our routine and the normalcy of life. And it's not just impacting us, it's impacting our family members too. And then when our family members experience stress, some of that stress can come on to us, as you call home and see how the day is going, and maybe your significant other is at home taking care of the kids who aren't in school now and trying to maybe homeschool them or keep them entertained or occupied, and they're not necessarily used to doing that because they're used to having the kids sent off to school, or maybe you're home having to deal with that. All of that can be create a lot of distraction in our life, and then we bring some of that to work with us, and it can cause us to get distracted in the moment of the job that we're doing, which brings us to another related barrier: preoccupation, or being preoccupied. There's a lot of things on our mind that we can become preoccupied, or ties back to worry about, but not everything that preoccupies our mind is necessarily worry or fear or anxiety. There's a lot of things that can preoccupy our mind that don't fit in those three categories. So we can't just say everything that preoccupies us is a bad thing. We can be preoccupied by good things too, by looking forward to something that we're going to get to do, at the end of shift, or when all of this is over, and whatever it is that we're thinking a lot about creates a preoccupation in our mind that can flaw our awareness in the moment. Understaffing is a barrier to awareness. And as I think about understaffing at emergency scenes, I think about, showing up at the scene of a house fire with 10 members when you need 20, and trying to get all the tasks and duties done with 10 that would normally be the tasks and duties that would be done by 20. But now that we think about COVID-19 and we think about understaffing, it takes on a different perspective because of the number of responders who might end up testing positive or have an exposure and being quarantined, and then creating understaffed situations, or even mandatory overtime situations, even still in an understaffed environment. And I think there's a significant potential consequence to situational awareness when you're operating in an understaffed environment, when you're normally used to operating with a crew of 4, now you're down to 3, or a crew of 3 and now you're down to 2, which ties into the next one: unpredictable staffing. When you're used to working with the same partner, you get to the point where you actually create a shared awareness, a shared understanding, where you know what each other is thinking, you know what each other is going to do next. And when you're working with somebody that you're not used to working with, that creates a certain amount of unpredictability, and it can impact your shared awareness. The shared awareness is getting multiple people on the same page of understanding at the same time, and it's a lot easier to do with somebody that you work with a lot and you know well. So shared awareness will be challenged as we work with unfamiliar people. Inadequate training, another barrier to awareness. A lot of departments have suspended training, and as they suspend training and getting together for training sessions, I fear that some of the things that they're not adequately training on is what to do appropriately in this environment of COVID-19, in the way of response, assessment, isolation, patient care, even showing up at the scene of a car wreck. If you have somebody at home with flu-like symptoms and dispatch tells you they have flu-like symptoms, you can take the proper precautions. When you respond to a vehicle accident, how do you know that the car that you're going up to treat that patient, and yet usually entails a very up close and personal experience, getting up to the vehicle, opening the door, assessing the patient up close and personal. How are we to know whether that patient is positive or negative? We don't. And how should we approach that? And I'm not here to teach you the right or the wrong, but this is the kind of training and discussions that our departments need to be having. And I know that our group training, our get-together in one space training has all but been eliminated from at least many of the departments that I have talked to, and probably rightfully so. Another barrier is a lack of clarity of mission. I think that from talking with people, I think out there in organizations, that there are some that don't really understand what this pandemic means for how they're supposed to operate, what they're supposed to take universal precautions for versus what types of calls they're not, that there is a lack of clarity of direction being provided to them from their administration. And it might be because of inept administration. It might be because the administration just doesn't know what to do either. And instead of giving bad information, they're just not giving any information. But that void of what do we do creates a lack of clarity around mission. This also ties to the lack of SOPs and SOGs. I think many organizations probably were not prepared in their SOPs, or their SOGs for a pandemic. And I understand that. I don't think our government on the bigger scale was adequately prepared for a pandemic. And I understand that as well. I'm not being judgmental. But the lack of SOPs and SOGs about what to do leaves us on the street level without a game plan to follow, without a set of procedures to say that I want to do it right. I want to do it the safest way, the most proper way, but I don't know what to do because we don't have any written guidelines on what to do under these circumstances. Another barrier is purposeful defiance to SOPs and SOGs. Out there in the world, there are always going to be people who are defiant to authority, defiant to policy, defiant to orders. We see that now where we're being asked and in some places ordered to do social distancing. And some will say, no, you don't have any right to tell me what I can and can't do. And I know that in our organizations, there are some that if we created certain policies that said this, in light of this pandemic, here are certain things that we shall do and shall not do, there will be some who will be purposefully defiant to those procedures. Confusion, a barrier to awareness. Out there in the world, there is a lot of confusion. As we're confused, we don't understand. As we don't understand, then it's hard for us to make predictions because of how much confusion is rifling around in our mind. And we can actually revert our situational awareness from that which is happening around us to the confusion that's in our mind. And if we are confused in the moment on an incident, our mind can shift awareness internally to that confusion, and we can find ourselves not paying attention to what is happening in the bigger environment around us because our awareness has shifted internal. And then we can experience mind drift, literally in the moment without any conscious awareness of what we're doing in the moment. Think about times that you've driven somewhere and zoned out or daydreamed or was thinking about something else while you were driving and then arrived at your destination and didn't remember part of the trip. Well, there were clues and cues and indicators happening all along in the trip. As your mind drifted out of awareness, you were no longer paying attention to those clues and that information in your environment. The same thing can happen to us on incident scenes when we experience confusion. Complacency, a barrier to awareness. Complacency essentially means we let our guard down. When we let our guard down, we're not paying attention to the things that are happening around us. I'd like to think that if given the choice between being hypervigilant and complacent, that we are leaning more toward being hypervigilant than we are being complacent. But I also know that the more we respond to calls where we don't have consequences, we don't have bad things happening, the more likely we are to become complacent and to let our guard down and to not use the universal precautions that we've maybe did in the beginning of this. I think as we flatten the curve, I think you're going to see some people become complacent, citizens and responders. We're going to say, okay, we've made the turn, things are going to get better now, and we're going to let our guard down. And in fact, we're still going to have a lot of people out there who are COVID-19 positive and contagious. And as we potentially become complacent and go out back into public settings without practicing social distancing, we are at risk of seeing another spike. And as first responders, if we start going to calls without the proper universal precautions, we could see another spike because we've become complacent. Another barrier is the sense of invulnerability. I was just talking with a chief today, and he said, I'm not that worried about it for our responders because first responders have a stronger immune system than the general public. And that may be the case. But what I had seen from a doctor in New York who was on a television show said one of the problems with COVID-19 is as it gets into the lungs, the immunity system attacks the virus and damages the lungs. So what they're doing, and again, this is just one doctor's report, you have to validate this for yourself. What he said they're doing is they're actually giving medication to lower a person's immunity so that the blood cells that would normally fight the virus don't destroy the lungs. Now, I'm not a medical doctor, so I can't speak to that, but what the doctor said is there's a lot of misconception that a strong immunity system makes somebody immune from COVID-19, which might be, in some ways be true, but if somebody then tests positive, then that strong immune system can actually become a liability or create a consequence for them. So we need to be very careful not to be gripped by our own sense of invulnerability. I know I've talked to a lot of responders that says, I've been through Ebola, I've been through SARS, I've been through H1N1, I've been through all these previous pandemics that we've had over the last 20 or 30 years, and I'm still here, and I didn't die, and this one's a little different. And if you're paying attention, you know that the contagious nature of this is different. We don't have a vaccine. We don't have a treatment. What we see in Italy is they're now having to make life and death decisions of who lives and dies because they don't have enough ventilators. And we're probably not far off from seeing that in New York, now called the epicenter, with the most number of cases, which makes sense because of their population. And I think you're going to see healthcare workers having to make some tough decisions. And a lot of it revolved around people feeling this sense of invulnerability, that it wouldn't happen to them. They felt fine, and they would go out and be social and be infected and not even realize it until, that went through its cycle to where they started showing signs and symptoms. Uncertainty, a barrier to awareness. There's a lot of uncertainty now in the information that we have and what it means for us and what the future holds for us and what is going to happen to our families, what's going to happen to our careers, what's going to happen to us financially. There's a lot of uncertainty out there. And, the best advice that I could give you is to stay focused on the things that are the most important. Your personal health, including all the things they tell you to use as precautions, the health of our family and our extended family, Stay focused on keeping our finances in order. Check with those who we owe money to and see what kind of forbearances they have to offer. There's a lot of companies out there that are extending forgiveness, if not forgiveness, maybe that's not the right word, but allowing for delays in payments, knowing that we're in a national crisis. Don't be afraid to reach out and ask them for some assistance or delay. Maybe you can get to where you could have, if you had your house payment delayed, where you didn't have to make a house payment for 3 or 4 months, what that might mean for you, or your car payment. And they'll tack it on to the end, but that's, don't expect them to just say, forget it as if it's been paid. You'll have to make it up in the end. But what you're looking for now is to find a way to cope and survive during the current crisis, and doing things to try to alleviate your financial concerns. And there's a lot of companies out there that are willing to do that. I fly a lot, and I had, when this pandemic hit, I had 25 flights scheduled with Delta Airlines. Now, Delta's policy is if you change a flight, you get charged a $200 change fee plus whatever the additional fare is to change it to something else. And Delta has completely forgiven all the change fees. So I had 25 flights at $200 a flight. I'm not really good at math, but I think that's probably close to $5,000. Somebody will fact check me out here. I got a calculator here. I'm terrible at math. So, yeah, $5,000. That's $5,000 in change fees that Delta Airline just forgave, which, had they not, would have been a very significant financial burden for me, not only to cancel the flights, but to lose $5,000, not to mention the business that I lost in that process too. So look to those companies who you have financial obligations to and ask them if they will extend you some courtesy through this event. And I suspect you'll find that many of them will. Pay attention to how you're eating, what you're eating. Pay attention to your exercise and make sure that you are physically exercising. Rest. Even short naps will help improve your cognitive capacity and reduce the potential of your mental fatigue. Just think about, as I was talking about, that walk and jog and run. If you run for a period of time, but then you stop and take a rest, then you can run for another period of time. So periodically stop and take those rests. And that on duty, that might mean napping. And I hope that your administration will understand and allow you to take naps during the workday, realizing that even if you didn't go on a call, that your vigilance is up, your mental fatigue is up, and the need to nap is essential to critical thinking and resilient problem-solving skills. Here's one other email that I got. Could you ask if you could do anything else to help? Everyone is planning and operating out of emergency plans with people who normally don't. Oh, like city officials. Okay, a lot of people who are outside of our normal operations are now having to follow emergency plans when they, normally, like city managers, mayors, other city officials, counties, state officials wouldn't necessarily have to follow these plans as we normally would follow operating procedures. What advice would you give us to make sure that our situational awareness is on top of the game, and what would you be doing at this time as an ex-chief that maybe you're not seeing being done now. I don't know that I can really speak to what isn't being done now because I'm really not on the front lines, although I am talking to a lot of people who are on the front lines, and I think the biggest void right now is a deficiency in accurate, timely, concise, communications and direction. And probably the greatest thing that we can do since you asked me from the chief's perspective, is making sure that we are visible and accessible to our members to answer questions. And if we don't know the answers, just say, I don't know the answer. I wish I did know the answer. I don't. Don't make it up. Don't try to fool them. Don't lie to them. This is not the time to try to be looking like you're the smartest person in the group. It's certainly acceptable to say that you don't know what you don't know. And in some cases, nobody knows. So don't act like you're the most knowledgeable person in the room or the expert at everything, because chances are you're not. So be humble, be compassionate, be caring, understanding, sympathetic, and realize that the members all have a lot of stress and a lot on their mind and a lot of things that are occupying their awareness beyond just serving the community when they're on duty. We're all in this together, and if we stay high level and professional, we don't eat each other up from the inside out, then we will get through this together. Since 2007, our instructors have helped more than 1,200 organizations and 85,000 individuals improve high-risk decision-making, including first responders, industrial workers, military personnel, business leaders, medical professionals, utility workers, highway workers, aviation workers, oil refinery operators, and more. If you or someone you love works in a high-risk, high-consequence decision-making environment, then we are here to help to improve your safety and your survival and to help you accomplish the most important goal of all, and that is to go home to the ones who love you. If you're interested in hosting one of my online virtual programs, we're not even doing live events. We're not even looking at scheduling live events till September or beyond. If you're looking at booking something September or beyond, get a hold of me through the website. But if you're looking at hosting a live virtual program for your members to kind of replace your live training, have me come in, talk to your members just like we're doing here on the show, then you can just go to the website and click the Contact Me tab, and I'll explain to you how we can do that. Remember to check our show notes for how to get connected with us on social media. We're on Facebook, LinkedIn, Twitter, Instagram, sharing ideas about how to improve situational awareness and the skills of critical thinking and resilient problem solving. Well, that's it. Episode 313 of the Situational Awareness Matters show is complete. Thank you to our platinum sponsor, Midwest Fire. Thank you to our feature segment sponsor, the Situational Awareness Matters Online Academy. Thank you to our associate sponsor, Chief Miller. But most importantly, thank you, the viewers and listeners of this show, for sharing some of your valuable time with me today. I really appreciate your support of the SA Matters mission. Be safe out there, and may the peace of the Lord and strong situational awareness be with you always.
You've been listening to the Situational Awareness Matters show with Dr. Richard Gassaway. If you're interested in learning more about situational awareness, human factors, and decision-making under stress, visit his website, samatters.com. If you're interested in booking Dr. Gassaway for a program, or if you would like to be a guest on his show, click the Contact Us tab at the top of the homepage.